Okay.
Okay. Thank you so much for coming. I will start with the numbers. I will do then some general comments, and we'll talk a bit about the actions that we've taken to date. So as you're aware, we're in consultation with Niagara Regional Public Health, and together we declared a C. difficile outbreak at the St. Catharines General as of May 28th, the Niagara General site, and Welland sites on June 23rd. The report as of today, at the St. Catharines General site, the total number of cases since the outbreak declared is 41. We have 20 confirmed cases currently inpatients. That is an increase of 1 from yesterday. We have 12 hospital-associated cases currently in the hospital, and a review is underway to identify there's an additional patient from yesterday, and we're doing the review right now. The number of community-acquired cases is 8. So those are patients that have come in to the hospital with C. difficile that they have acquired in the community. We have had 10 deaths at the St. Catharines site since May 28th. The Greater Niagara General site, there are 14 cases. We have 13 confirmed inpatients, so that's up 1 from yesterday. There are 9 hospital-acquired, and again, same thing. We have a review underway to identify the cause of that. We have 4 community-acquired cases, which is the same as yesterday, and we've had 4 deaths. At the Welland site, there are 12 cases since the outbreak declared. 10 of them are confirmed inpatients now, and that again is 1 up from yesterday, but that is a relapse of a previous case. There are 7 hospital-acquired cases currently in the hospital. That's not a change from yesterday. And 2 community-acquired cases in the Welland site, and that is up 1 from yesterday. And we have had 2 deaths at the Welland site. So some general comments I want to provide first. We've heard clearly from the media and the community about concerns regarding communication of this outbreak. So this briefing is part of our renewed approach to communicating through daily media briefings. Our intent is for you, the media, to share with the public what you have learned. Bringing the outbreaks to rapid conclusion continues our primary focus. It is our central priority. That is all that we are focused on doing. Going through this is very difficult for everyone, particularly our patients and families. As a nurse, my heart goes out to those people who have suffered with the illness and those who have lost a loved one. We are working 7 days a week around the clock to manage this outbreak, and caring for our patients is our central priority. While our main concern is for patients and families, we're also focused on our staff, physicians, and volunteers who are working again around the clock, doing everything they possibly can to keep us out of further outbreaks and to get this outbreak over. We are trying to focus internally and keep our staff from getting distracted by the politics and the media. Hence, we are here as the face to the media. We're very proud of the work that our staff and physicians and volunteers are doing, and we need to support them in every way we can, and we ask for your support and the public's support in helping our staff. Outbreak or no outbreak, we work very closely with Niagara Regional Public Health Department. In the weeks prior to the first outbreak being declared at St. Catharines, we were in regular contact with Niagara Regional Public Health officials. We were very fortunate to have Associate Medical Officer Dr. Val Yeager participate from the very beginning in outbreak calls in St. Catharines, and since then we've had Dr. Andrea Feller and Dr. Jessica Hopkins on a regular basis, and they are providing direction and guidance in our regular calls. We have twice daily calls, and that includes our public health officials on those calls. Internally to the Niagara Health System, we have a 3rd additional call that does not include public health, but it is our own internal, keeping us on track of what have we implemented, what is left to do, and what is the plan to implement any changes that we are making. Precautions at St. Catharines site were intensified prior to the outbreak declared on May 28th. These include several things. So 2 weeks prior, we reinforced dedicated equipment and enhanced cleaning of ward equipment, such as stretchers. We flagged all suspect C. difficile patients, which we do on a regular basis, outbreak or no outbreak. We did re-education of our staff on C. difficile control measures and terminal cleaning of all of our rooms, which includes everything, top to bottom, walls, floors, absolutely everything of any patient that was discharged on our medical inpatient floor. We invited the Regional Infection Control Network twice to review our practices and provide advice. We invited the Provincial Infection Control Resource Team to gain their input and advice. They came last week, as many of you are aware. And although we do not yet have their written report, we did get a verbal report from them, and we've already implemented a number of their recommendations. including that we've reached out to our peer hospitals who have had similar experiences to learn from them. St. Joseph's in Hamilton has loaned us an infection control physician until we can increase this resource internally. We've implemented a consistent face to the media with Joanna and myself as lead spokespeople. We've relieved our antibiotic stewardship pharmacist of her other duties so she can focus purely on this. And antibiotic stewardship, I think Joanna may get into a little bit more, but is really one of the causes of C. difficile in antibiotic use. So when you give antibiotics for one thing, they often kill the normal bugs in the bowel that prevent you from getting C. difficile. And giving those antibiotics, when someone comes in with something where they must have antibiotics, we have to watch which antibiotics for which bugs, and then look at, are there other options that we could be using? And this is what an antibiotic stewardship physician, which we have, and pharmacists are doing. We've implemented and begun a full facility Virox rescue procedure to have a one-time full facility clean. Top to bottom, Virox is a gel that is used to clean. It's similar to bleach, and it actually has bleach in it. So it is a full facility clean, and we have started that as of today. We're changing our cleaning priorities. One of the recommendations was that there were areas that we were cleaning that we didn't need to clean, which was interesting for us to see. An example was there are areas on the walls that we don't have to clean, but we should be focusing on other areas. So they call them high-touch areas. And the area, for example, the wall behind the headboard of a bed is not a high-touch area. So they've suggested that we focus on the priority areas and clean those. We've added additional housekeeping staff, and we're working to make this permanent. We have our Vice President and Health Program Director at each site have done and continue to do daily rounds on all the units. So in the 3 sites, you will every day, including weekends, have the Vice President and the Health Program Director, someone at least, going unit to unit to make sure they have all of the supplies and equipment, they have all of the support that they need. We have asked them for their feedback. Are there things that they could give us advice on things that they see that we might not see? We have invited a provincial field epidemiologist to come and review our tracking mechanisms and our data collection, etc., and they are coming later this week. I'm going to ask Joanna to talk a little bit about the complexity of outbreak.